Yeah, okay. Good morning, good evening, everyone, all the dear friends. Today we delve into the silent but pervasive threat impacting millions worldwide. Our goal today is to deepen awareness and empower proactive strategies to protect the heart and our of lives of ourselves worldwide. Today, I have been allotted three topics: hidden salt, hypertension, and heart by Mr. Sareen. So, I think these all the three things are interrelated somehow or the other. So, I will just start by the small topic that is hidden salts. That is equally dangerous and very uh, cautiously used. Hidden salt is the sodium, it is the sodium chloride. This is what we all eat use every day from ages. है ना? We can see it as a white powder, but to our surprise, this is more what we use and see every day. This is a hidden salt. What we use, that is that we can see, that we can measure, that we can decide how much to put and how much not to. But this hidden salt is very, very scary, which we don't even notice. So it's more dangerous to our health when excess of dietary salt, sodium chloride, is consumed. The body retains the water to dilute that salt in our body, to process that salt which we have already taken in. So that increase of volume, that retention of the water, that increases the pressure on the vessels. And this pressure gradually it is converts into the hypertension because the blood vessel has to put more pressure to push the blood forward. That is why the blood vessels exert more pressure. That results in the thickening of the blood vessels, stiffening of the blood vessels, and increases the risk of stroke, heart disease, kidney problems, hypertension, all across the world. है ना? There is one small incident which I just read few days back. कि जब भी हम अकेले में कुछ काम करते हैं, किसी को नहीं बता के हम करना चाहते हैं, that comes out in the world. Everybody comes to know it. अगर हम धीरे से कोई चुपचाप अपना कोई अच्छा सा लिटरेचर पढ़ते हैं, तो that comes out in your behavior, your way of speaking, your way of behaving in the society. If we eat silently without telling anything, that is some, if we are reading something good, how disciplined we are, that will show in your achievements. How much exercise we are doing, that will show in your physical appearance and personality. This looks how much chaat, pakodi, kachori, bikaneri bhujia, and what we have eaten, that will exist, that will raise your blood pressure and turn into hypertension. Similarly, it stands for the sweets also. If you are more interested in eating chocolates, cakes, pastries, rasgulla, and other sweets, diabetes will. Then we'll have to definitely go to our physician, our doctor, and he'll come to know what we are doing. We are eating more sweets, we are eating more namkeens and everything. So this all comes through the hidden salts. All the salty things which are eating, these are having hidden salt. For example, very common thing of the hidden salt which are daily we are using are breads. Daily in our kitchen, we use bread, cereals, soups, condiments, for example, ketchup, mustard seeds, all the dressings of the salads. Sorry, pepper paste, chutneys, green dressings, guacamoles, एवोकाडो बेस्ड डिप्स जो भी बनाते हैं, मैंगो पिकल्स, बटर, चिली पेपर्स, caramels, cheese, creamy sauces, everything all have salt in them. And when we Other things are peanut butters, salsa, all processed packaged foods, baked goods, processed meats, snacks, potato chips, crackers, pretzels, everything these have salt in them. So we should avoid to spot this hidden salt and to avoid keeping them in our shelves, in our kitchens. Whenever we go to the market and buy something, all these packaged, we should read the label written on them, how much salt it is having. And every time it is not written sodium, yeah, this thing. There are supplement names also, sodium related terms, monosodium glutamate, sodium nitrate, sodium bicarbonate, or disodium glutamate. These other names are also written on uh, the information of the chart, which is on stuck on the packings. So we should avoid all these things. So our recommendation will be that we should always go for the fresh food, home cooked food. We should eat vegetables, use fruits, cereals, for the seasoning, for the taste. Instead of putting more salt, we can enhance the taste and flavors by herbs, spices, garlic, onion, ginger, citrus juices, vinegars in place of salt. So it is very important to change our cooking habits and the things which we are very, very interested. And for the last many years, we are in habit of using all those things. We should curtail their purchasing and storing them. So this, whatever damage which we are doing, at times it is mindful damage. We know it that I am eating potato chips, this will harm me, but even because of the taste, we keep eating many things. The other excess of things may risk of the high blood pressure, risk of the cardiovascular diseases, heart attacks, and strokes. Other conditions also are related to the stomach. At times, it develops more spices and everything develops stomach cancer and osteoporosis. So any type of salt, whether it is pink salt, white salt, rock salt, or table salt, it is sodium in the basic. So we should be using it in very small and moderate amount. But we, of course, we cannot just restrict sodium salt intake at all for our body, which is also not very beneficial because we need some amount of salt for the muscles and we need for the fluid balance of the body. These are very important. For this, we definitely need some salt in the foods, daily foods. So complete elimination is not needed, but moderation and awareness of the hidden salt is very important. Otherwise, we may land up in hypertension, heart diseases, kidney failures, and many things we can come across. So hidden salt is very dangerous for us. We should avoid it and we should advise our children also to take precautions and be aware of it. So by nature, they will withdraw from that. This is our hidden salt. Uh, can I shift to the second topic?
Before you do that, Ushaji, there's a question came from the audience
Oh,
that
sure.
what is the difference between the sodium chloride and sea salt? Any difference?
Mm. I just told you this thing. Okay, the sodium chloride and sea salt, they all are sodium-based things,
They're
but
still the same.
there are other types of sodiums. That is, it can be monosodium glutamate, sodium nitrate, sodium bicarbonate, or disodium glutamate. These can be any other forms than the sodium chloride alone. So rock salt, sea salt, they have different molecules of sodium in all these ingredients.
Okay.
I have a question. What's the difference if we take potassium? Because they say potassium is okay.
Yes,
But
yes,
they,
yes, definitely.
chemically, they are almost same.
No, no, definitely. I was about to tell you this thing also. If you are not taking sodium at all, we can supplement that by potassium also, because potassium also has almost similar, close to the sodium salt activities. So it will also give you some effect of the sodium in our diet. So we can replace sodium by potassium also.
I have another question.
Yep.
I don't have a problem of high blood pressure. I have problem of too much low blood pressure, and I feel dizzy. So systolic is like 100. If it goes below 100, then I feel dizzy. It's like a 99 or 60 or something like that.
Huh.
So what do we do?
Actually, electrolyte imbalance is very important in the body. The water retention or excess of water excretion, that also help some difference occurs on the body system. If more urination is water is going out by urine, then you will lose some electrolytes, and mostly which is lost is either sodium or potassium. So instead of sodium, we should replace it by potassium. That is not that harmful as sodium is.
Yeah, I'm taking a water pills
So that,
because
and this
of the,
cause of low blood pressure, and this mainly main cause of low blood pressure is that your heart pumping system is slowed down. It is not that fast or strong to circulate the blood in the periphery blood vessels and all. So that way, in any change of your position, hypotension occurs. That is osteostatic hypertension. So because of that, if you stand up suddenly, your blood pressure will fall and you will feel dizzy. So that is why it is very important that you should maintain, balance your electrolyte balance. Sodium, potassium, it should be equally should be maintained in the body. Hydration is very important. And this,
डॉक्टर साहब
yes, sir.
I have a
मैडम
question.
पोटेशियम क्लोराइड में कौन सा साल्ट होता है? पोटेशियम सोडियम क्लोराइड वी नो क्या ऑर्डिनरी साल्ट है या रॉक साल्ट है? दीज आर ऑल सोडियम क्लोराइड. पोटेशियम क्लोराइड में कौन सा साल्ट होता है?
पोटेशियम
name
होता है.
नहीं नहीं,
potassium
किस नाम
chloride.
से जाना जाता बाजार में? किस नाम से मिलेगा ये?
पोटेशियम
They are
किस नाम
pills.
से मिलेगा? पोटेशियम का कोई पर्टिकुलर नाम नहीं होता है ऐसे.
मेरे ख्याल से इट इज नॉट वेरी फेमिलियर कि हम पोटेशियम क्लोराइड के नाम से मांगे और मार्केट में मिल जाए.
नहीं नहीं, K has symbol. There is a K, potassium, and many times it is on the even. There is some name is Lona. You can say ask Lona, that is low sodium, uh, L low amount of NaCl and sodium. That is potassium. Lona.
Yes,
Or
one of some of
you can
the natural things,
you can
some of the
test.
natural things you can have is
Yes, sir.
like eating bananas,
Fruit,
right?
mosmi,
Fruits like banana will give you potassium.
मौसमी मौसमी हो सकती है, बनाना भी है, and citrus fruits में most citrus fruit you can have.
Yeah.
Okay, let's continue with the
So
discussion. We'll come
those
back with the question and answer later on, please. Let's do the next step and then we come back. Okay, Ushaji.
Yes, sir.
Go ahead.
So my topic is hypertension. That is very important and what is very common. Hypertension, blood pressure or the high blood pressure is more than just a number. It is the key driver of the cardiovascular disease and leading to the cause and very common cause of leading cause of death globally. Hypertension is a medical condition where the pressure of blood pushing against the walls of arteries is consistently too high, then it is silent killer. Because people with hypertension do not have obvious symptoms or any signs before they end up into a serious problem. So mainly hypertension is recorded in two forms, systolic pressure and diastolic. Systolic pressure is the pressure when the heart pumps the blood out. You know? And that comes the higher one. That number is higher, but it should never be more than 120. If it is more than 20, then it comes into the category of hypertension. Second is diastolic pressure. It is the pressure recorded when the in between the pushing blood out from the heart relaxes, and there is another beat comes to push out the heart. That at that time, which is pressure recorded, that is diastolic pressure, and it should not be more than 90. If it is less than 90, more than 90, then diastolic hypertension. And if it is more than 140, it is systolic hypertension. So causes of these are the two types of hypertension, systolic and diastolic. Then causes of hypertension. There are many causes of hypertension, primary causes or the essential causes. इसमें mainly genetics plays a very important role. Then age of the patient. Mostly the elderly patients, they have hypertension. Then lifestyle. Your lifestyle is very important in developing hypertension in your body. Then environmental factors also, they also play a very important role in hypertension. So these are the primary essential uh, points how the hypertension appears. Then secondary hypertension, in this, there are some underlying diseases, pathology in the body which is already present. For kidney diseases, hormonal disorders, certain medications, they also cause hypertension. And the sleep apnea. At times when a person is sleeping, it develops difficulty in breathing, tongue falls back and apnea occurs. That can also raise the blood pressure. Then other risk factors are high, more amount of salt intake, obesity, then physical inactivity, tobacco intake, alcohol intake, family history, then other age related, more than 65 years of age, mein, whatever comorbid conditions our body is having, like diabetes, kidney disease, or air pollution, that is environmental condition, that is also adding in our raising our hyper blood pressure. So this is how we are prone to get hypertension. It may be primary, secondary, or other risk factors. They give us our body some changes, something happens, and we develop hypertension. What are the symptoms when somebody is having hypertension? The mostly patients, to begin with, they have no symptoms at all. They just say, "Thak gaya, aaj sir mein dard hai," that is all. They will never notice that they are having hypertension. Unless and until at times it becomes severe case. When severely hypertensive crisis mein chale jate hain, then only they go to doctor, get themselves checked. Otherwise, they say dizziness, headache, pain chest, blood vision, at times nosebleed. These are all the symptoms which should be noticed, and especially in the elderly people, where any lead to hypertension show up as hypertension. Many times in the diagnosis of hypertension, there acts the rule of Helms. This describes many challenges, that is awareness of the hypertension, treatment of the hypertension, and control of hypertension in the community. In the rural areas or even cities also, people are unaware of the hypertension. They will not realize, if I say you have blood pressure high, no, 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 मेरे को तो ऐसा कुछ नहीं होता, मैं कोई दवाई नहीं लेता, मैं बिल्कुल ठीक हूँ. So they will avoid realizing that they are having hypertension. And because of this, their adamancy and their thinking, they will not respond to the treatment. if somehow they are treated, or by accidentally they are caught by a doctor and they are advised some treatment, they will take for a few days. When they start feeling better, they'll stop taking treatment. They won't repeat it again. They will not go to doctor even, unless and until they have some other episode of seriousness. Then some people, if family is understanding, their kids they push up, no, you should take medicine. They'll take medicine for some time, and the blood pressure will get better. It will be under control, and whenever it comes in control for some time, they'll leave the medicine. They will not take medicine. So that it is very dangerous. So it should be we should be very particular whenever we are diagnosed with hypertension. We should regularly take the medicines. Whatever our physician has advised, we should stick to it. So many times, the hypertension is such a disease which remains undiagnosed, untreated, and undertreated. So this is how, mainly in the rural areas, we have come across many times when we organize some health camps in the rural areas. We used to come across all the males. We are going in their farms, working there all day long, but they are having hypertension and they are not realizing. We used to tell them, okay, look, this is the normal thing. You should take this medicine. नहीं साहब हम तो ठीक है जाएंगे काम करेंगे ठीक है कुछ नहीं करना. So this is how this becomes a dangerous thing for the hypertensive patients. Now, one thing important, whether it is in the rural area or in the cities type, big metropolitan, चाहे कहीं पे भी हो, alcohol consumption. I will say, where is Vipin ji? He'll just point out, why Usha ji, why we cannot take, we cannot, where is Judge IB Singh ji? He will just point out why alcohol is so dangerous, why I cannot take 2 packs every day. So at times, alcohol is, I'll tell you one thing, there is biphasic effect of alcohol. Whenever you drink 2 packs, you feel you are fine, blood pressure falls for some time, and you feel, yeah, I'm relaxed now, I'm better. I'm 6, 7 hours, hello, 6 to 6, 7, 8 hours, they'll be very comfortable. Yeah, we are relaxed, we are happy, and they'll enjoy their life.
Yeah.
But after some time, there is hike in the blood pressure. And that happens after 7, 8 hours. At times, they went to sleep. They were very happy if we enjoyed and I'm relaxed and I'm sleeping. And at times, their blood pressure spikes so high that they even, at times, many times, during sleep also, they becomes very serious, very severe. And at times, cardiac heart attack. Even heart also stops due to this high blood pressure and everything. So we should be very, very particular in consuming alcohol more than what is required. अच्छा आप यहाँ बैठे हैं क्या? अच्छा बलबीर सिंह जी
नहीं? Okay.
उषा
जी
आपने जो कहा ठीक है अच्छा है तो आपने कहा कि मतलब should be within a certain amount. So what is the optimal amount?
2 pegs. Normal pegs, 30 ml.
Yeah, just a second. Sorry. But so what is the optimal amount?
The doctor told you.
Hello?
30 ml, I think, because I don't know how much you all enjoy. Patiala pack nahi chalega.
Kandala, I can see you enjoying yourself. Sangeeta is doing the same thing. तो पटियाला पैक की बात नहीं हो रही मतलब वो तो
He doesn't drink at all.
but he doesn't drink at all.
Radhe ji, he doesn't drink.
No, Rufus. Rufus and Kalpana. Kalpana, yes. She's very happy.
All the jokes apart, we should take everything in moderation. As
Correct.
age advances, we should be particular about our well-beings.
So why not? Extreme is zero drink.
Right.
Zero drink is also an extreme.
Yeah. And the drink is there also extreme.
Zero drink is not extreme. Zero drink is good.
No, zero drink is extreme on the negative scale.
Positive scale.
But
Negative
it's
is
not
drinking.
every day, उषा जी, मतलब हर दूसरे एक दिन एक ड्रिंक लेने से क्या फर्क पड़ता है?
कोई कुछ नहीं, nobody is stopping you from doing that. You can enjoy drink. Twice a week, it is okay. And that also 2 pegs can will it
Two pegs, okay. I'll keep that in mind.
A week. A week.
a week.
In a week.
I said twice a week. 2 pegs twice a week. Is it okay?
दुकानें बंद हो जाएगी दारू का मतलब
हाँ, ऐसे में से ऐसा कहा तो दुकानें बंद हो जाएंगी, दारू का क्या पता?
नहीं, या वीक की डेफिनेशन बदलनी पड़ेगी. वीक सिर्फ 3 दिन का होना चाहिए. 3-day week.
Yeah, 3 days. 3 days.
Good. Sorry, go on.
Okay, go ahead.
Okay, sir.
So Sona, excuse me for interrupting. Sushil Joseph has a question which I also have. If you can please ask Dr.
Sure.
Mathur the answer, please.
Happy.
Thank you.
Right now?
Yeah, the question is, please differentiate between sea salt and chemically prepared NaCl.
I think
What
she
is
already
the
did
difference?
that. She already did that, Rufus.
I missed it. Can you please repeat?
Yeah.
I whatever I know, I can tell you that thing. Sea salt or the rock salt or the white pink salt, these are all natural sources from where we get these salts. While NaCl is even laboratory mein we can mix sodium and chloride. When it is mixed, NaCl forms and salt comes out. So it is chemically, it is made in the laboratories, while other sources are हमारी सांभर लेक है राजस्थान में. We get salt from there. That is not sodium chloride का pure form नहीं है. And sodium, all the other salts, sodium chloride, which we get in the packets, Tata salt, that is fortified, ionized, that is the chemical form of sodium chloride.
Now, Dr. Mathur, the question is rock salt, sea salt less dangerous than chemically prepared NaCl?
Actually, no. They are not safe, but in less amount, you can take those salts because they are not chemically treated.
Right. Thank you. Thank you very much.
Okay.
Yeah.
Okay.
All right, continue.
But from these sea salt, rock salt, we should also be very careful about the impurities which we can get from there. So that should also be processed before we start using it. Not from the lake directly and in the kitchen. No, not that. Now we come across in the treatment of the hypertension. For the treatment of hypertensive, there are many medicines. Antihypertensives, these are known as. And these, there is one saying, DASH diet. For the hypertensive, there is a DASH diet. That means it is dietary approach to stop hypertension. So we should, those who are on DASH diet, they should have rich potassium, magnesium, calcium, and fibers. They should include all these things in their diets to reduce the hypertension, risk of hypertension. We should more vegetables, fruits, whole grains, fat-free or low-fat dietary products. Dairy products also we can use, but they should have of low fat and less fibers वाला होना, less fat and low fat का होना चाहिए. You can use fish, poultry products, beans, nuts, seeds, everything you can use in the diet for those who are having hypertension. But everything should be the limit sodium. Added sugars you should limit. Red meat should limit. And sugary beverages you should limit always. all the canned foods, canned beverages, cokes, anything, all those canned things, they should be, because they are always added salt to as a preservative in them. So they should be avoided always to check our blood pressure. These are all common causes of hypertension. They're how we come across the symptoms of the hypertension and how we should avoid having hypertension, diet advice and everything. There are some different reasons for the females to develop the hypertension. But in the females, mostly, there is some hormonal influence that is more in females than the males. So females mostly have hormonal influence of the high blood pressure. At times, pregnancy-related causes of hypertension. Then many times, ladies are on contraceptive pills. They are hormonal contraceptives. So they also cause high blood pressure at times. Then obesity, some metabolic syndromes, chronic stress, and lifestyle. That is very important. That is how females are more prone to blood pressure. They are always under stress. So मजे से जीजिए, अपना लाइफ एंजॉय कीजिए, काम होता है उतना करिए, नहीं होता तो ना करें, कोई जरूरी नहीं काम करना हमेशा. Am I right, Kalpana? I'm good. So no stress of home.
और सारा
Then
काम बंदे कर लेंगे, बंदे कर ले रहे हैं काम.
there are some commonly problems which are found among the ladies, females, is rheumatoid arthritis. Because of rheumatoid arthritis also, you have some problem with the heart also. Rheumatoid heart also develops. So hypertension and heart-related problems, those females are more prone to. And in the younger age, menopausal age se pehle, there are polycystic ovarian cyst also. That is polycystic ovarian syndrome. That is also very common among the females, and that causes hypertension. Then there is a big group of things which comes under menopausal syndrome. It starts from 45 above. 45 years के बाद में many ladies have a problem of menopausal syndrome from 45 to 50 years when the menopause occurs. Before that, they have weight gains, then some salt sensitivity. Sorry, I have. These are some causes. Low estrogen also causes hypertension. Then salt sensitivity to diet also, that causes weight gain causes. And in this age group, we find diabetes also. So at times, metabolic causes also occur in the females when they develop hypertension. Then comes the treatment of hypertension. There are many medicines these days. Doctors, physicians, they think what is good for a patient according to his conditions, causes of hypertension and other environmental conditions, everything taking in consideration. They prescribe antihypertensive. They are of different groups. Some antihypertensive acts on the blood vessel walls. We relax it, and the heart compression that stops. Then ACE inhibitors, calcium channel blockers, beta blockers, alpha blockers, vasodilators. These are all forms of the antihypertensive medicine. And this depends on your physician, what he thinks is the best for you, that he prescribes. So we should never interfere with the treatment that is your physician is advised, and should not leave in between your treatment. And if there is some reaction or some side effects you observe, you should immediately go and complain to your physician. just make and notify that this is what is happening to him. So these are the medicines. They antihypertensive act on the different levels of the body, the circulatory system, to normalize the blood circulation and everything in the blood. Many times, combination therapy is also advised by the physician. They'll give you one antihypertensive, and some vasodilator also at times they give you along with that, and diuretic. Diuretics are the medicine which will retention of water. They will release that water from the body. That will pass through the kidney and you will feel better. The pressure created will be reduced. So water retention in kidney is very harmful. It will not occur. So diuretics are advised to the hypertensives also. So we should be very particular in taking treatment of the hypertension. Diet also, we should eat less salt, less sugars, curtail everything in your diet. But eat green vegetables, fruits, fresh fruits, citrus fruits, juices also you can take, green vegetables, home cooked food. That is very good for the hypertension. And so I'm done with my hypertension topic. Any
Okay.
question right now or later on?
Yeah, we can unmute, everybody unmute, and we can have a question answer session now.
Sure.
I have a question.
Sure. Please go ahead.
Whenever when I go to Indian stores to buy things, most of the Haldiram products, they all have palm fat, and I avoid that. So because they're like a 99%, they have palm snacking things, palm oil. I'm not looking for salt content, but palm oil. That is always there. So I disregard the Haldiram product altogether, and I look at other. But made in USA, fried in New Jersey and New York area, they have a healthy oil, canola oil, and all that, but not palm oil. And I think palm oil is one of the big culprit for heart attack and other problems. And another one is high fructose corn syrup. USA, all the most of these drinks like Coca-Cola, Pepsi-Cola, and all that, they have high fructose corn syrup. That's another worst thing, So I stay away from those.
Keep it up, and advise others also who are very fond of it.
Why don't we post our question on the chat so I can moderate that? That way everybody has a chance. So put your question on the chat. So now I'll ask a question. There's a question from Sushil Joseph. Question is, Dr. Mathur, can allopathy cure hypertension, that is reset the body systems so that you can come off of the medication? Continue the question. What are the side effects of these medications?
Actually, all the medicines, allopathic medicines, mostly they are prepared in the factory, in the companies, and some salts are added in that. So allopathy is definitely some chemicals, some things are already different salts are mixed and the medicine is prepared. If you are very keen about it, you can try other medicines also. In Rajasthan, we have Ayush system of treatment. That is Ayurveda, homeopathy, naturopathy, and Unani, where we follow all these types even in our government hospitals also. We have all these 4 doctors also sitting there. Those who are not very comfortable with the allopathic treatment, they can switch on to other branch, other type of treatment. But surety, doctors cannot give any surety of those treatments.
All right. Next question is from Vipin Sagal. This question is about, is Sanda salt also harmful?
Salt in every sort, every form. If it is salt, it is harmful. But if it is taking in a moderate amount, it is okay. Because you cannot stop completely the salt intake. Otherwise, your water imbalance, body में आपका electrolyte imbalance, that will harm you more.
All right. Next question is from Shiv Parihar. At our age, what can be the upper and the lower tolerable limit of blood pressure without medication? Our age mean our age of 78 plus.
Oh, I couldn't follow. Please, sorry, sir. Just
Okay,
repeat
so
the question.
I give you example. You know, at the your all the
Systolic-
medical
systolic
charges, systolic 120 over 80 is the standard. For a young man of 20-year-old versus a man 80-year-old cannot be the same. So that's the question. So
Yes,
what is
yes,
what's the limit for us people at our age?
Elderly above 70 years, we are not compelled to keep our blood pressure 120, 80, 120, 70. Our blood pressure can rise up to 140, 90. That will be normal. Because at this age, all our blood vessels, arteries and vessels of the heart, they are also having some weakness in their muscles, their structure and everything. Their working is also reduced a little bit. So 140/90 is okay for hypertensive patients also. If it is 140/90, you're normal.
All right, 140 over 90, Shiv, that is the number to follow.
Okay.
Not be worried if you are having 140/90.
What about the lower ones?
Lower, if it is, if you can tolerate 130/70, you are okay. If you're 120/80, you are okay. 110/70, even that is also okay. But it depends on your body, how it functions with it.
All right.
सोना एक क्वेश्चन पूछना था मुझे सोना.
Shamlal, post it on the chat. Next question
मैं
is from
पूछूं सर?
Shamlal, post it on the chat. Chat के ऊपर लिख दो. Next question is from Kavra ji. Can taking rock salt for years instead of normal salt may result in high TSH as there is no iodine?
Coverage?
Question to you, Dr. Mathur. From Kavra. Can taking rock salt for years instead of normal salt?
उषा भाभी, हम लोग पिछले 10 साल से सिर्फ रॉक सॉल्ट ले रहे थे नॉर्मल सॉल्ट की जगह. और पहली बार जो अभी 3-4 महीने पहले जब ब्लड टेस्ट कराया, जस्ट ए रूटीन ब्लड टेस्ट, तो उसके अंदर TSH वाज अबाउट 6, जो कि नॉर्मली 4.5 कुछ होना चाहिए.
That means your thyroids are affected.
Yeah. So then when we talked to the doctor, I mean, then he said, because you are, then I asked him that we are taking the rock salt.
So
Then he said, you stop rock salt and take normal iodized salt.
Yeah, that is what I was about to say. Your rock salt doesn't have iodine in this. So iodized salt is very important for the body.
Body, yeah. So whether we have done correct, अभी पिछले 3 महीने से हम लोग normal salt लेने लग गए.
You will be feeling better now.
I see. Of course, इसको टाइम लगेगा. मेरे का लगता है TSH को नॉर्मल आने में तो अभी सुधा का 6.5 था, वो 5.9 पे आ गया 3 महीने के अंदर. तो मेरा 5 पॉइंट कोई था.
नहीं, for this case raised THS, have they tried something for the thyroid?
Pardon?
Hypothyroidism के लिए कुछ ट्रीटमेंट एडवाइस किया है आपको?
नहीं, वो क्या बोले, I mean, हमने बात किया था इसके लिए जो स्पेशलिस्ट रहता है ना, उससे तो बोला कि unless it is 10 or beyond 10, then we suggest tablets, not otherwise.
fine. It is
हाँ,
good.
yes.
Alright, I got few
So
more
we are not taking any tablets or anything.
That's very good.
All right.
Yeah.
Okay. Next question. I got one question and two statements. So let me read the statement first. Statement one is from Ramaswamy. He says, one of the natural ways we have found to reduce sugar level is to a teaspoon of methi powder soaked at night and drinking in the morning. That's one thing for them. Next is from Sushil Joseph. Says all sea salts in moderation are good for us because these salts have some 80 plus minerals which are the same proportion as in the human body.
Right.
That's from
That's
Sushil
true.
Joseph.
Correct.
That's correct.
That's true. That's
Okay,
true.
the next question is from Suresh Sharma. Do BP medicines damage kidneys?
BP medicine.
Yeah.
Actually, if you're irregular, and does blood pressure medicines damage the kidneys? Actually, blood pressure medicines, it is not the medicines which are damaging your kidney, it is the blood pressure, the fluctuation of blood pressure. That is damaging your kidneys. If the medicines are undertaken, they are not regularly taken, or the doses are not correct, that means your kidney is overworking. Your kidney is burdened, and that is why it is going towards a failure. So you should be particular about your revising your treatment of blood pressure and stick to that treatment.
Okay, my question from me, Usha, one of the things we didn't talk about is yoga. I have noticed that I can take off 10 to 12 points of systolic blood pressure within 10 minutes if I do Chandra breathing, breathing from left nostril and letting out of the left nostril. It came from my dear friend Sushil, and it really takes the blood pressure off 10 points immediately within 10-15 minutes. Not Kapalbhati, it's Chandra breathing. It is breathing from left, letting out of left.
Chandrabhedi, yeah, Chandrabhedi.
So
okay.
that is without medication.
Actually, I tell you, yoga, exercises, this is what we always advise to the people to do this because they help in your blood circulation, their muscle strength. Actually, this builds your muscle strength. So coping of the function or the muscles or the vessels, that is promoted. So whenever you will do exercise, you will see that your blood pressure is coming to normal, your blood sugar is normal, you're feeling good, you are more active, you are more happy. So exercise always affects on the body.
Good. Okay, Shamlal, you have a question. You cannot write on a chat, so go ask question.
राइट सर मैडम मैं करीब 22 साल से हार्ट का पेशेंट हूँ और आज से 15 साल पहले मेरी हार्ट सर्जरी हुई थी मुझे नींद बहुत आती है रात को 12 बजे सोता हूँ सुबह 8 बजे उठता हूँ और दिन में भी 2-3 घंटे में सो लेता हूँ खाने के बाद में तो इज इट ओके या समथिंग वेरी सीरियस
एक्चुअली इसमें कोई सीरियसनेस नहीं है अगर आप फ्रेशली उठते हैं सोने के बाद में एट दिस एज if you are sleeping 8 to 10 hours, that is normal. That is not, there is nothing wrong in it.
बहुत साउंड स्लीप आती है मैडम बहुत साउंड स्लीप आती है दिन में भी और रात को भी
बहुत अच्छी बात है ना सर यू आर सो केयर फ्री आप तो अच्छा सा अपना वो कीजिए सब
अरे सोना
हाँ
मुझे बाबा अब मुझे फ्री कर दो मेरा सोना योग के
Actually, this excessive sauna will make you dull at times. So you should go and sit in the sun for some time. Sun exposure is very important to make your body active. आपका reaction होगा थोड़ा सा vitamin D बनेगा. You will feel more strong in the bones and muscles and everything. So you sit in the sun for some time. तो आपका सोना कम हो जाएगा.
उषा जी
नहीं ठीक है मैडम मैं धूप में बैठता हूँ आधे घंटे में धूप में ही बैठता हूँ तो दैट केयर आई टेक
Okay.
उषा जी what Shamlal does is he sleeps for 10 hours बाकी 10 घंटे ये लोगों को तंग करने के लिए उनके मैसेज भेजता रहता है हजारों फ्रेंड्स ग्रुप में, फैमिली ग्रुप.
अरे फ्रेंड्स ग्रुप में तो मैसेज कम कर दिए भैया, फ्रेंड्स ग्रुप वालों को तो चैन होगा अब.
Okay, any more questions?
फ्रेंड्स ग्रुप वालों में चैन नहीं है, तूने दो दो नाम से अब शुरू कर दिया.
श्यामलाल 1, श्यामलाल
अरे
2.
भैया, फ्री मैसेज का जो प्रतिबंध है वो केवल फ्रेंड्स ग्रुप में है, पॉलिटिकल ग्रुप में नहीं है.
अच्छा, ये किसने कह दिया?
भैया पॉलिटिकल ग्रुप का देख लीजिए आप, कोई कोई उस पर रिस्ट्रिक्शन नहीं है कि आपका 3 ही मैसेज होना चाहिए, और है तो कर देगी उसमें भी, कोई दिक्कत नहीं है कम करने में.
Sona, I have a question, please.
हाँ जी, प्लीज सुरेश.
Sona, Usha ji,
Yeah.
I'm told that as your BP increases and your dose of the BP medicine increase, that affects your kidneys. It damages your kidneys. Is that true?
Yeah, of course. That is renal hypertension develop हो जाता है. That is, this hypertension is related to the kidneys only. Because of high blood pressure, at times the filtration of the kidneys that is impaired.
So is it because of the high blood pressure or the medicines themselves?
High blood pressure also can cause this renal impairment.
No, I was told that when the dosage of BP medicines increase,
No.
that is harmful for the kidneys.
At times it may be if it is overdosing of particular salt, then the filtration rate reduces kidney ka, and that may be causing some problem in your kidneys.
Okay.
I have a question.
Any comment from you, Sheel? Sheel, any comments from you?
On what, Sona?
Any of this?
No. I think you have conflict of many systems, so
Yeah, there's a conflict, yes.
I don't want to get into it.
Okay. Then, okay, we'll leave that for some other day.
Yeah.
I have a new question.
Mother have a question.
Mr. Sushil, it will be better if you say something right now, so I can also correct myself at some points if I am going wrong.
No,
Actually, I'm not dealing with any applied things, just basics I'm telling. What should be done, what should not be done. This is functioning, this is a problem, and this is how you create problem, you can stop problem. This is all I do. I don't go for clinical applied anything.
yeah. I think my take on it is allopathic medicines don't heal hypertension. They manage hypertension, while there are other systems that can actually heal hypertension, which means your heart or blood vessels can be corrected and you can be off medication, because allopathic medication has a lot of side effects, and you will be treating the side effects very soon because of this prolonged use of allopathic medication. So it's always wise to go to other systems like Ayurveda, Siddha, whatever, where discuss the problem with the doctors and find a solution where it'll actually heal your system, and go to the source. Don't treat the cause. Go and treat the source of the cause. Why are you getting hypertension? Is it stress? Address the stress issue. Is it food? Address the food issue. If it is lifestyle, address the lifestyle issue. So you have to go to the cause of the hypertension rather than treat the hypertension with medication.
Yeah, that's very true, Mr. Joseph. There is, I just told you, if you just went through it, we have a common group, Ayush, under the head of Ayush in the government of Pakistan.
Yeah.
It is with the Ayurveda, homeopath, naturopath, and Unani. All these types of treatment are under one roof in the hospital.
Yeah.
The specialist doctors of all these types of treatment. They are sitting in the outdoor. You can consult them. You
Yeah,
can
be
discuss
of they
And-
be your first approach to treatment. If
yeah.
everything else fails, then you can go and try allopathy.
Exactly. No, you are very correct. Many people now, they are leaving allopathies because of the side effects. And for the side effects, you will be treated on the symptomatic treatment. If you have vomiting, stop vomiting. If you have diarrhea, stop diarrhea. That is what allopathy's approach is mainly, to stop the emergency. Otherwise, Ayurveda, Homeopathy, they have, as they say, that they can cure. So it depends on your own wisdom, what you want to opt. Suresh Bhai, I'll advise you to get your kidney function done. He's muted.
No, Suresh is, no, he's
Suresh,
listening.
okay, I'll talk to him.
Any more questions?
Yeah.
Yes, madam.
I've been taking, because of the heart attack I had several years ago, twice, I've been taking a blood thinner. And sometimes if I have bleeding somewhere internally, I stop the blood thinner and the blood becomes thick, normal blood. So what is the effect on high blood pressure while I'm temporarily getting off the blood thinner?
Actually, blood thinners are for the heart patient. They are advised. So blood should be, it should remain, and so it can flow through the blood vessels comfortably. And if you stop thinners, then it will start atherosclerotic process will start, and the blood will stop flowing freely in the lumen. So blood thinners, under advice only, you can stop or discontinue. Otherwise, you are always advised for a heart patient to continue the blood thinner.
Yeah, I'm not against taking the blood thinner, but sometimes a little cut here and there.
Yeah.
If I'm
Aspirin, especially, if even you are going for some small surgery, he'll first say, if you are going to dentist, he'll say, stop your aspirin for 7 days and then come to me, because they'll cause bleeding otherwise. So thinners will lead to bleeding. At times, there is my relative close to our house. I met her 2 days back. I saw big patches on her skin, on her hand. I said, what has happened to you? This is drug reaction. She said, nahi, aspirin se ho gaya mere ko. Because she was a heart patient and she was on aspirin, blood thinners, and she developed this thing. So she had to discontinue it for some time. But you have to be very vigilant when you are discontinuing thinners. Your blood clot should not happen. Your obstruction doesn't happen. Heart problem na ho jaye, chest pain na ho jaye. That should be, you should observe for that.
But
a simple way of thinning your blood is drink extra water. Hydrate yourself extra.
That's very true. That's very true.
So your blood will automatically become thin.
But if you stop taking the blood thinner, if you stop, if the person is taking aspirin all along, like, for 10 years and all that thing, I was taking for 10 years and then switched to Eliquis just recently. Like when I had cancer, they switched it from this aspirin to Eliquis, which is more expensive, but I don't know what is the difference between the two. One is almost free, another is more expensive, but regardless of price, I had to stop the blood thinner so that if there's a cut, it will heal only if there's no blood thinner.
Yeah.
You have to stop aspirin or whatever you are taking, then only you will heal. Or as she is saying, dentist, Dr. Usha is saying, dentist will ask you to stop taking aspirin.
Yeah, when you stop, you start drinking extra water.
Yeah, drinking water, normal water is very, very beneficial for the body. All the जो भी हमारा excretion होना चाहिए, that is done very swiftly and smoothly by the body if the water is there.
Yeah. But my question is, what is the effect on the blood pressure numbers? Does it go up or does it go down when the blood is
No,
thicker?
it'll be normal.
You'll stay same?
Yeah.
No, when your blood becomes thicker, your heart,
It'll rise.
basic fluid engineering, when your
It'll
Yeah.
rise.
becomes thicker,
Mechanic.
the heart
It'll
has to
rise,
pump
definitely.
harder. Okay, so the blood pressure will go up.
Go up. Definitely, it'll go up. If
Which
it
is good for me. I got sometimes the blood pressure is all systolic is 100 or less. So if I stop taking blood thinner, then that's a solution. It will go up to maybe 110. Then
But
it will be okay.
whatever titration you want to experiment, don't do it by yourself. Just consult to your physician first, take advice from your doctor, and then only do all these titrations. Should I stop this? Should I raise this? No.
Yes.
Not by your own self.
All right.
Usha ji
You're
and
smiling.
Sushil.
Kalpana, you're smiling.
Yes, sir.
You have a question? Why don't you ask? Unmute, Reddy. Unmute. Reddy,
Yeah.
unmute. Yeah.
No, I just wanted to compliment Dr. Mathur on how practical she is in her explanations. So I
Absolutely.
really appreciate that. Yeah.
Thank
Very
you
good.
so
Thank
much.
you.
Thank you so much, Katna, for doing this. Thanks a lot.
Right. And I just want a quick question, both from Usha ji as well as Sushil. Like, we talked about the necessity or the benefits of drinking water throughout the day. What about drinking tea and coffee? Is that the same as drinking water?
No.
No, they are not. They are not.
Drinking coffee,
Because-
tea, and alcohol, they are different.
No,
Same.
they'll stand in the same row.
I mean, there's water in tea and coffee.
Water is on the top, and they are all at the same level of not using them very frequently.
And water passes away in 5 minutes. Drink full glass of water, in 5 minutes it will be through if you have nothing else in your stomach.
No.
Okay, let Usha.
Yeah,
There's
early.
one important topic is remaining if you want. If I can continue today, or we can postpone it to some other day. If everybody is very tired of me now.
No, just answer this question of coffee and tea, and then we'll end.
My heart topic is still remaining. So I have not discussed anything about the heart. So
Yeah, that's okay.
like-
We'll do that some other day. But let's answer the question of tea and coffee. About Vipin ji.
what is tea and coffee?
सोना 1 मिनट लूंगा 1 मिनट केवल just 1 minute.
Shaman, just a minute. Let me finish that first. Vipin asked a question about tea and coffee. Are they same as drinking water? And
No.
Usha ji
No,
answered,
I said
no, they are not.
I said no.
Okay, last question, Shamlal, what is it?
लास्ट ईयर मेरा एक्सीडेंट हो गया था कार का. मेरा बेटा ड्राइव कर रहा था, मैं पीछे बैठा हुआ था. तो ट्रक से एक्सीडेंट हो गया तो करीब 20 फुट गड्ढे में सड़क के किनारे कार गिर गई थी और मेरा सर जो था आगे वाली सीट से टकरा गया था. तो इमीडिएटली 10-15 किलोमीटर पर कोई हॉस्पिटल था, मुझे वहाँ एडमिट होना पड़ा. तो मेरी नाक से खून बहे चला जा रहा था. तो डॉक्टर ने पूछा क्या ब्लड थिनर लेते हैं क्या? तो मैंने कहा हाँ डॉक्टर साहब, मैं तो हार्ट पेशेंट हूँ, ब्लड थिनर लेता हूँ. बोला इसीलिए मुश्किल हो रहा मुझे आपका ब्लड रोकना. इट टुक अबाउट 1 आवर जो मुश्किल से ब्लड स्टॉप कर सका मेरा नाक का. तो ब्लड थिनर के बारे में काफी बातें हो रही थी. तो आई थॉट इट प्रॉपर टू टेल दिस एक्सीडेंट टू यू.
This is very important. Blood thinners, if you are on blood thinner, any sort of bleeding, that point will not stop until that is taken care of very strongly. So you should, blood thinners, that is a very negative point, I should say. If you have a small cut, you will keep bleeding. If you have nosebleed, it will not stop. So you should be very careful when you are on blood thinners.
All right, Usha ji, thank you so much once again. as always, thank you very much.
Thank you,
for
Thank you.
everything.
Thank you.
Really appreciate that.
For being
Thank
Thank
you,
you.
Dr. Usha. Thank you very much.
Thank you. Thank you.
Thank you.